menopause, like someone like me who's had to have um clinical menopause, and so it's just a whole range of things going on. And please, for everyone who's tell us where you're joining us from and one symptom that you wish more people talked about, please put it in the chat. That will be helpful, and then we'll get into asking Dr. Jai some questions, and also Lola, whilst Lola will share some of her own personal journey and some of the symptoms that she's experienced. And then hopefully Dr. Jai can help us crack some of these nuts tonight. So welcome everyone. Thanks for joining us. So I'm going to go with you first, Dr. Jai. What exactly is this perimenopause and or menopause? And why are there so many? And then also break down for us briefly what is fibroids, and then why are women so when we get to a certain age, what's there that is happening to our body that some of these things that we don't even understand, we can't even explain, we don't have words for it. Lola just started with saying it's doing a number. Trust me, it is doing me a big number, this perimenopause. Well, recently I heard that I've actually hit menopause because I did a test recently. So Dr. Jai, tell us a bit more about perimenopause, menopause, what it is. What is this for women to understand?
Thank you very much, Tony. And, a lot of women I talk to, especially when they are in their late 30s, early 40s, are actually quite surprised. And maybe for many of them, they don't want to accept the fact that their body is changing because in their mind, they still see themselves as maybe 20s or in their 20, in their 25s or 30s, but in actual fact, internally, the body clock is beginning to change.
Mm-hmm.
And not many women are willing to accept the fact that, this is it, you're getting into it until it becomes sometimes a little bit far gone.
Mm-hmm.
So perimenopause is actually a phase, is a transition towards menopause. Now, I tend to ask people, do you know what age your mom went through menopause? Not many women know. I'll say, okay, the average age for many women is 51. That's the average age. Some women go through it a little bit earlier. Some people go, a lot earlier, a bit later as well. Now, 10 years before the age of 51, you can begin to feel the symptoms of perimenopause.
Mm-hmm.
So basically, perimenopause can happen sometimes 2 years, 5 years, 10 years before the actual menopause. And what does this mean? It means that your hormones are beginning to fluctuate. Your hormones don't drop from 100 to zero. They kind of go through a
The times.
slow decline over a period of time.
Mm-hmm.
And that means that you begin to feel the symptoms. And in fact, some women tell me that it feels like they are going mad. And then the next
Ah.
day, they're absolutely fine.
Mm-hmm.
So,
Mm-hmm.
so you can imagine what happens there because your hormones are going up and down, even almost like a step case. You know how it stairs, go down and then slightly. So your hormones drop down, you feel it, and then it normalizes again. And then you begin to wonder, oh, was I making that up? So for many women, I would say that they will go through menopause in their 40s. Some women will go through perimenopause in their 30s, late 30s. Now, menopause itself can be natural menopause or surgical menopause or
Mm-hmm.
or chemical induced. So we have to be really careful about terminologies.
Right.
Um, as a doctor, the way I would diagnose it is always through women's symptoms. If you come to me and you tell me that your periods are irregular and you're beginning to have symptoms of you're not sleeping well, your mood is all over the place, your memory is a little bit foggy, you're very tired, that makes me suspicious that you probably are beginning to go through perimenopause.
Right.
Now, earlier on, you talked about fibroids and perimenopause can be overlapping. Yes, they can
Mhm.
be overlapping.
Tell us a bit about fibroids, and then we talk about the point where all of these symptoms are overlapping, and then how can women kind of tell, okay, is this the fibroids that I'm dealing with, or is this perimenopause?
Okay, fibroids, I'm sure a lot of us have heard about it, so
Mhm.
I'll try my best to simplify it. I don't want to make it too medical. And
Sure.
some people describe it as lumps in the womb. Some people describe it as muscle growth, but basically, one, it's not cancer.
Mm-hmm.
The what we call benign growth in the muscles of the womb. And sometimes these things can be small, they can be large.
Mm-hmm.
And sometimes they cause absolutely no symptoms, other times they cause a lot of symptoms.
Mm-hmm.
It is very common. Statistics tell us that 66% of women would develop at least one fibroid during their lifetime, and
Mm-hmm.
only 33% of those women would have symptoms. So it is very, very common. And the main symptom for fibroid is usually heavy periods.
Mm-hmm.
Some people would feel like pressure, like a pelvic pressure. Some people just say they're having pain in their waists, waist
Mm-hmm.
pain. Waist pain can be caused by a lot of things. Some people feel bloated. And in fact, some people, obviously, some people have problems with their fertility.
Right.
Some people feel pregnant, but they are not pregnant. Some people bloat a lot. So there are a number of different symptoms. You'll be surprised that a lot of people with fibroids also have emotional problems. They have depression and they have, all sorts of emotional problems because of a number of different things. And that
Okay.
is where you begin to think which one is fibroid, which one is
Mhm.
perimenopause.
Exactly. Exactly. Thank you. Thank you so much for that. And I also wanted to say, one of the reasons that honestly we're having this conversation is also to just bust some of the myths, around, believe, around especially perimenopause, because especially around the age. And I know you highlighted that when you started, the average age, but some people start to experience perimenopause even early, mid 35s, And so for me, it's also creating that awareness and not saying, oh, you have to be at this age to start to experience that. And then so if you have these symptoms, maybe something else is wrong, just being able to see holistically what exactly we're dealing with by identifying our symptoms, you know, um, whilst we're on this journey. Um, Thank you for that. I'm going to go to you, Lola, quickly. So before you had before you had a language, what were the symptoms that you were experiencing? Did you what changes did your was happening in your body that you thought, okay, what's going on with me?
So I've kind of I used to feel a pain in the left side of my tummy, especially most times when I'm ovulating. So I'll just, and even when I'm pregnant, I'll feel the pain throughout the whole pregnancy. So the 2 times I was pregnant. So, but there was one particular time that I felt that pain, and the pain, it just normally within a few days it will go. This pain was just there for like at least a minimum of 2 weeks. So I just said, let me go to the doctor because I don't know, maybe it's not what I think it is.
Mm.
So I got there and the first doctor was like, because the pain it's not even where, so you press it, if I press it here, I'll feel it. If I press it, then by the time I press that same place, the pain has moved a little bit to somewhere. So she was very dismissive. Oh, where is it? I can't even feel it. So I left that one. I went to see another GP, and he was very much more. He was more empathetic, and he was like, "Oh, let's go for a scan. I'll send you to gynecology." And they came back and said, "Oh, you have quite a few fibroids, but they're small, so maybe just manage it through pain." But recently, I started having some serious. I mean, I was going to the toilet so often, so I stopped drinking too much water. And even when I want to, it's not like, oh, I really, really need to pee. It's just the irritation in my bladder. I just needed to pee. And sometimes I'll go to the toilet and there's nothing. And then even when I want to pee, the thing I'll be begging it in, oh yeah, come out now. As in like, please come out. I have to focus to even get the pee out. I have to like, and then there was this pressure, like as in, especially when I want to poo, the pressure can be there for like 2 days. As in like,
Uh,
I won't be able to sleep fully until that poo comes out eventually. Then I'll now feel like okay, and then pain, just like my tummy is biting me everywhere, like oh, especially
I,
my below my bloated neck, everything, sha. And
I
it
can
just so I don't
imagine.
even know. So went to see the doctor, the guy. I was referred to the gynae. Then she said, "Let me do an examination," because I've had something called pelvic vein congestion. I thought maybe it was maybe that again, but then she said, let me do an examination. She said, then she said, your womb is like 18 to 20 weeks pregnant. I'm like, what does that mean? She said, yes, your womb is as big as that right now. So obviously the fibroids over time have probably grown, and that's why they're giving me so much problems right now.
Yeah.
So I've had a scan and all of that. So I'm just waiting to hear back from the doctor. I mean, she has said that I should just remove the womb. I should do a hysterectomy. That since I'm done with children. But yeah.
Mhm.
But then I had some other symptoms that I'm not sure if they're related to it or related to perimenopause. So there's a
Okay.
lot of nerve pain, like in my arm, down my legs. So I'm actually on pregabalin to kind of maintain, stop the pain, prevent the pain
Pain.
at the
Yes.
moment. So I don't know if it's related to it or not, or to perimenopause, because I hear that fibroids can sometimes maybe sit on some of the nerve. I don't know,
Yeah. Well,
and cause nerve pain.
thank God we have a doctor here who's going to help us to crack some of the nuts, and whatever it is that we can't answer tonight, we will take away and we'll come back, because this conversation is not even over. Honestly, it's just a start of it. So, Dr. Jai, over to you. I'd like you to kind of address some of the symptoms that Lola has mentioned, and also if you're able to kind of also what should women should be looking out for, especially around when they're at that age where they're perimenopause or menopausal, and especially if they've had fibroids. So what kind of symptoms are, and how can women just differentiate to say, okay, this is the fibroids, or this is perimenopause, or maybe something else?
There's so much to unpick from that.
I know.
It's just having someone talk about their symptoms so openly is actually quite liberating,
Mm.
and more we're hoping more women will be able to come forward to talk about some of the these incredible symptoms they are experiencing, so they can get help. I always believe that women are the fabric that holds society together, and once
So
a woman
true.
is already suffering with so much pain and so
Mhm.
much distress, can't sleep, pain in the nerve, pain here and there, it can be difficult to do what you've been called to do.
Mhm.
The impact you're called to make in your own community, in your own society. So thank you very much for sharing all of that with me. So first of all, let's start with the symptoms: heavy periods, severe cramps, bladder pressure,
Mhm.
exhaustion. First of all, you have to accept that this is not normal.
Mhm.
And it's really important to be able to go up to your doctor to ask them questions. Now, I'm feeling this, and you'd say, oh, this is it. Is there any test I can do to find out what is wrong with me? Okay, you
Mhm.
said I've got fibroids. Apart from surgery, is there any other options of treatment? Are there any other specialists that can see me, that
Mhm.
can help me understand what is going on with my body? So those are really important questions. You should never be afraid to ask your doctor's question, even if you feel the first doctor hasn't answered you. Like Lola said, just go back to your another doctor and get some help from that other doctor. Now, let's start with the mention of pain on one side. You're
Mhm.
absolutely right. When you feel like, well, this is my ovulation pain, but it seems it's a bit stronger than what I'll be experiencing, then
Mhm.
that is a sign that definitely you have to go and figure out why this problem is there. Why is it more than I would normally experience? Why am I bleeding heavier? What is going
Mhm.
on?
Mhm.
Perimenopause can cause irregular bleeding, no doubt about it.
Okay.
And some women in perimenopause, some women begin to use a lot of natural treatments. I think we've talked about this before.
Mhm.
And some of these natural treatments, what we call phytoestrogens,
Yeah.
because you would have read online, you would have followed somebody online, and they will say, oh, phytoestrogens are really good, or buy this,
Mhm.
buy that. And you
Mhm.
begin to use some of this natural
Explore.
treatment.
Yeah.
Some people with fibroid, we find that actually their fibroids get worse during this period of time, and
Okay.
that might cause even increased symptoms of pain, pressure on your bladder, pressure on your bowel, difficulty opening your bowel because the fibroid is actually blocking those passages. So it's really
Mhm.
important to tell your medical practitioner what you're using, what you are trying. So that is really important, because when you're feeling symptoms of menopause or perimenopause, you say, oh yeah, I want to do this thing because my friend told me to do it. You
Yeah.
probably might be making something worse in your body.
Oh, you can say that again. You can say that again. I experienced that with magnesium. But carry on.
Yeah,
Carry on, Dr.
okay.
Lai.
I mean, I don't take anything. No, I'm just like right now. I just take painkillers.
So one of
And
the
I even
things
hear about the food. Sorry, I heard about the food as well. Madam Tony was saying I should not eat yam again. I say okay now. So what should we eat now? They say we
should we
need
eat?
estrogen for the perimenopause. And yam, there's yam cause I mean estrogen causes the fibroids to grow. So then like
Yeah, I
It
mean,
yeah,
can be
damned if you do, damned if you don't, right?
yeah,
yes.
yeah.
It can be really confusing. But if
Mm-hmm.
you remember that fibroid is a hormone dependent condition.
Yeah.
And what
Right,
that means that your fibroids feed off hormones. So like your
right.
estrogen, especially estrogen. So that means, especially during perimenopause, there's one graph I like showing people what
Mm-hmm.
happens to your hormones. So let's start with the basics. When you get to perimenopause, you're not releasing an egg every month.
Mm-hmm.
Some months you would release, some months you won't. Normally,
Okay,
when you release an egg, there is an hormone called progesterone that comes up with when you
okay.
release an egg.
Right.
Now, when you don't release an egg in some months, that means you won't have enough progesterone in your body.
Mm.
And what that means that you would not be able to sleep well. You will be having brain fog. You feel tired. Now, coincidentally, what happens is that your body is still releasing estrogen, so there is some kind of estrogen progesterone imbalance. So
Okay.
you're actually high in, is so to speak, high in estrogen, normal estrogen, but very low progesterone. So there's a big gap there
Right.
compared to where it should be following each other. There's a
Mm-hmm.
big gap. So when you have certain types of food that increase the estrogen level, then that estrogen will begin to feed the fibroid. I don't know if that makes sense.
Yeah, it
Absolutely makes
does. Yeah,
sense.
it does.
Yeah, it does. It does. Thank
And
you.
that is why you will begin to find that the fibroids grow larger. They begin to cause a bit more blockage compared to when you were in your 20s, when your hormones were better balanced in your 20s. So
Mm-hmm.
Mm.
that is the reason why some people will be say rather than focusing on high estrogen food or phytoestrogens, just make sure you have a balanced diet.
Mm.
Eat high fiber, eat things that would help your body release the high estrogen and balance things up for you. Now, I'll quickly go on to the other part. You talked about nerve pains. You talked about nerve pains in your arms, in your legs. Now, I have to say, I don't know your full medical history. It's obviously important to get help from your doctor.
Mm-hmm.
But that to me does not necessarily relate to fibroid because fibroid is quite local, it's down in your pelvis. It can press on nerves, definitely, but the nerves it press on is usually from the lower end of the spine or around the neck of the womb. And that can cause a bit of, pins and needles sometimes. But when it's affecting your arms and your hands, that is a little bit, it doesn't fit in with the picture of fibroids. And that's where it's really important to, talk to your doctor and say, and if they say it is fibroid, you ask them why they think it is in a very respectful way, just so
Mm.
that you can understand how to help yourself better. Um, I think I've answered most of the questions there, but I'm happy to go on.
Yeah. So quickly, I actually just to also speak into that. I also have leg pain and it's severe. And now that we're talking about nerve, something pressing on nerve. So before I had hysterectomy, I had severe. So I had to have a lot. Well, not a lot, maybe about twice or three times lumbar puncture because of the severe migraine that I was having and all of that. And so now I have okay, well, they did say oh sciatica and all of that. So I'm wondering, is that from the perimenopause? I mean, because what Lola just said now about pain in her leg, and I've been on strong painkillers. So I'm thinking, is that from the perimenopause? Well, I thought I was perimenopause until recently. I had a test done, and came
You've
back
gone
and
through
said,
it.
"Oh, now you're in menopause." I'm like, really? But because I mean, I couldn't tell how my journey went only because I've had hysterectomy, and that induced, of course, the menopause, and of course my hormone decline and all of that. I didn't know at what point what happened. But basically, so my question was, peradventure, this pain that Lola is describing, because I also have severe leg pain. I've been told, oh, now there may be a nerve trap somewhere, and maybe sciatica. Is this part of perimenopause or menopausal symptoms? Is because I had to go on the strong painkillers.
Yeah, so even I'm currently on pregabalin for the nerve pain, and it's sometimes it's very severe. Like it literally almost like stops me breathing properly when it starts. So, but they've done MRI of my whole spine. They've done MRI of my brain. They literally cannot find what is wrong. So I'm still on the pregabalin. They're looking to ease me off it or wean me off it because my memory is like it's short. My
No,
focus is short.
that's
And
perimenopause, that memory thing.
well, apparently pregabalin also causes
It can
those
affect
kind
your
of like,
memory.
Right.
yeah. So
Okay,
I'm having, if it is perimenopause, I'm having it double like right now.
I can
So
imagine.
So yes, pain is such a delicate one to talk about because we know that there are so many different sources of pain, and the way we all perceive pain is actually all quite different.
Mhm.
Pain definitely can have its source from a muscle, it can have its source from a joint, it can have its source from a nerve, it can have its source from the brain as well. The pain in perimenopause, a lot of women describe severe muscular pain.
Mhm.
Severe
right.
muscular pain. Some
Yeah.
women obviously, and I always say to people, look, estrogen, progesterone have receptors scattered all over your body. Your pain threshold, and just the same way some other thresholds, are disturbed in perimenopause, that can cause a lot of problems with perception of pain
Right.
generally in the body. But also there are other specific causes for pain and things like very low vitamin D levels, which is actually quite common in women of dark skin, is another important reason. And in fact, it's interesting to note that vitamin D is one of the, even though we call it a vitamin, it's known to actually have some immune effects on the body as well. And women with fibroid, we tend to recommend that they start taking vitamin D supplements,
Mm.
partly because of this reason as well. So vitamin D is one thing I would always recommend to be checked whenever women come to me saying they have muscle pain or nerve pain and they can't really find. I'm sure your doctors would have done it, but it's always one thing to have in mind. But there are other several causes, of muscular pain. It's always really important, like Lola has done, to just make sure you are tested thoroughly for any autoimmune condition as well, because autoimmune conditions can also
Mhm.
cause muscular problems. So, you have to ask those questions from your doctor. Is there anything else that could be causing this muscular pain? But yes, fibroids can press on the nerve around the end of the spine, especially if you have fibroids that are growing outside the womb, and they can begin to push the muscles and the nerves and the ligaments of the spine in
Mhm.
such a way that they cause a lot of problem. But also remember, arthritis in the spine,
Mhm.
um, arthritis in the disc can also cause problems, like pain, nerve pain as well. So there are lots of causes. It's really important to always make sure you have it checked, and also things like vitamin levels to be checked as well.
All right.
Are
Oh,
there any like really surprising symptoms from perimenopause that people don't know about that maybe women have described and obviously doctors have not really found, and you can only maybe perhaps prescribe it to perimenopause or menopause?
Perimenopause.
before you answer, because I know that with perimenopausal symptoms, people have different things. I've had
Mhm.
heart palpitation. Everybody's got different kind of things. And at some point, I mean, I went to like a symposium where there was a long list of it. So different women will have different things. So I was like, okay, at this junction, is this still perimenopause or is there something else? Because there's a long list of symptoms. So different women, different things. So yeah, go on, Dr. Jaya, quickly. I just
I,
wanted to add that.
no, I agree completely. I can't remember the exact number, maybe something along the lines of maybe 33 symptoms of perimenopause, menopause. There are some early warning signs. I think irregular periods is one of the very early warning signs.
Right.
And then obviously the other bits like the brain fog, memory issues, pain, fatigue, sleep
Oh, fatigue.
problems,
Please tell me
and
about fatigue.
all of the other symptoms begin to come in. But yeah, you're right. Even things like itchy ears, dry skin, acne for some women,
Mhm.
it can range. And I suppose what then happens is that once you have been tested, especially if you're in your early 40s and you're having a number of different symptoms and you go for extensive tests and they can't find anything, then they would normally say, oh, yes, you've gone through perimenopause. For women over the age of 45, a blood test is not needed to confirm perimenopause because, yeah, you may do the blood test and the blood test comes back as normal. But we
Mhm.
know that your body is definitely going
The
through
hormones are declining.
change. Yes, yes.
Oh wow. Oh wow. Thank you so much. Thank you. Thank you for speaking into that. So my other question is I know that okay, so Lola's shared some of her symptoms. And can a woman experience both? Because I know that earlier on Lola was talking about me saying, oh, not to eat yam because if it's fibroids, because if you have fibroids. But then can you also because there's that myth that oh, after a certain age, the fibroids will shrink or they will go away. If you have fibroids and then you get into menopause and all of that. But can a woman experience both? You know, the
Yes.
mm-hmm,
Definitely, women can experience both symptoms, and that's why menopause is like a perfect storm in a teacup for a lot of women. From the ages of 20 to 30, a lot of women are usually having children or managing their career and stress. By between the ages of 30, 40, you've accumulated a high degree of stress that by the time you get into your 40s, the body keeps the score.
mm-hmm,
Now, on top of that natural stress accumulation over the decades, if you now have a gynecological problem like fibroids or endometriosis or adenomyosis or even polycystic or what we call PMOS now, polyendocrine metabolic syndrome,
mm-hmm,
your body has been firefighting for a long period of time, carrying those either hormonal problems or metabolic problems. So by the time you get into your 40s, and that's why many women experience perimenopause early, because
mm-hmm.
they are exhausted from fighting internal fights, not necessarily external fight. And that's why symptoms of, I mean, fibroids would always be fibroids. They are there permanently. Some people are lucky, it shrinks. Some people are lucky they actually pass it out.
Really?
Some
Oh.
people do pass out their fibroid. And some people obviously would have an operation to remove it. Some people have hysterectomy. But by the time women are having hysterectomy, the fibroid has shown them pepper, so to speak.
As in, he's showing me Pepe.
It
As
would
in,
have shown you pepper, like you would have become anemic and you would have had so many other problems that probably you haven't even understood until they remove it. And then you begin to realize, oh, I thought fibroid was my problem. They've removed the fibroid. Why am I still having all these other
all these other things.
problems?
I hear you. I hear you. And
And that's the issue.
yeah, and I hear you. And this was my case because I mean, to go slightly into food, I wasn't properly educated about my conditions. I was trying to change lifestyle, have a better lifestyle. I had fibroids, so I said, okay, let's try. I like coffee. Coffee, I hear, is also bad with fibroids. But I started drinking soya milk. And we know that soya is a feeder for fibers, but I didn't know this at this time. I was drinking a lot of coffee with my soya. I was in a stressful job in the city. And so all of these things just made things worse. And I was not just anemic, I was losing my life because every other month I was in hospital for blood transfusion. I was bleeding nonstop for 2 years. It was that bad, only because I started. Well, I've always known I had fibroids. So, but only because I then changed the lifestyle, thinking I was trying to do good. But of course, I went to get the things that will make the fibroids bigger, and worsen my situation with what I did with the milk, with the soya milk. So at what point can women, is there a test to be able to tell what's what, especially if you're in that perimenopausal age, and then you're dealing with fibroid as well? Is there a test to be able
Test.
to, yeah.
Well, to be honest, there's nothing as good as talking to a doctor that is empathic, that understands, that wants to listen to your story. So first of all, it's important. The first test is speaking to a doctor and explaining. The doctor would take what we call a history. They would
Hmm.
ask about all the symptoms you're getting. And if you say to them, look, I am concerned about perimenopause and fibroid, they would ask you specific questions. And
Hmm.
it most of the time is from these questions that most good doctors will be able to tell you, or I think you might have mainly this or mainly that, or a combination of that. Now, after they've asked you the questions, then you need to be examined. Sometimes with fibroids, especially big fibroids, a good doctor will be able to feel it when they examine you, even from your tummy,
Yeah.
Yeah,
because they will
yeah,
feel
You
that
can even
there
touch it.
is,
You, the patient, can touch it.
can
I
touch
used to be able
it.
to feel the thing. I'm like,
That's
what? In my
correct.
tummy. Yeah.
That's correct. So that take a history, we examine. There are some blood tests that can be done.
Right.
Now, perimenopause, we know by the age of 45, most women would be there's something happening. So a blood test to confirm perimenopause is not necessarily important after the age of 45. But before the age of 45, yes, you can have some blood tests. That blood test will check for your hormones, but it's important to check for other things like your iron level. We talked about iron.
Hmm.
It will be important to check for things like thyroid disease. It will be important to check for things like autoimmune conditions. But a lot of these tests would need to be personalized to the story you have given your doctor.
Yeah.
Now, after that, that's the blood test. There is also a scan. A scan will be able to pick out what is exactly going on there. So there is a lot of overlap, no doubt, but some of the tests will give us a clearer idea of, is it just the one, or
Right.
is it the two of them
So
that
both
is
of them.
going on?
Okay, amazing. Thank you. Thank you so much. All right. So this I wanted to ask Lola, did you feel dismissed, during this journey, and how did that impact you? Uh,
yeah.
yes.
The first time, yes, I did feel dismissed very, very much so. The lady was just not, she didn't really want to hear, But the second time I went to see he was quite empathetic, and yeah, referred me to a guy. She listened to everything I had to say, and then she was one who examined me and said, "Ah, this your womb is like 20 weeks pregnant kind of womb." So yeah, the definitely was dismissed.
Mhm. Interesting. Thank you. Dr. Jai, I'm going to come back to you to ask how should women advocate for themselves, especially, if because I was actually gaslighted, because whilst I was going through my fibroids, and my consultant, every time I went, okay, so from start he offered me hysterectomy. I'm a Nigerian girl, I'm like, I don't want to remove my uterus. Just like that. So I was negotiating, and this is how over a year I went into bleeding nonstop because I was eating wrong food and all of that. But every time I turned up that, okay, what is it next this time? So I started feeling like, okay, is this things all in my head, or is not as bad as because I was feeling like life was leaving me, but this man was here minimizing my pain and gaslighting me and making me feel like it's not as bad as I mean I am making it sound. So my question to you is, how would you usually advise women to advocate for themselves, especially when they go to see their consultant, you being a clinician yourself?
So first of all, women need to learn about perimenopause in their 30s. I think that's really important. Everyone should feel knowledgeable enough to be able to say that, look, I am confident that I know what the symptoms and signs of. I'm just starting with perimenopause first of all,
Oh.
so that when they begin to see the changes, they can, they won't be caught off guard later. Now
Mm-hmm.
that makes them confident when they go to their doctors. So that's first of all, start learning about your female hormone, your female health, your women's health right from your early 30s. Now, secondly, is what I would call red flags.
Mm-hmm.
And this is basically, I want to make women feel empowered so that when you go to see your doctor and you feel like they are not listening to you, you should
Mm-hmm.
feel confident enough to trust your instinct to say that this doctor, there's something not quite right with the way this doctor is talking to me or dealing with my symptoms, and make you
Mm-hmm.
feel like you could go back to talk to somebody else.
Mm-hmm.
Now, there are some red flags that should make you feel confident to say, look, I really need help. One is if you are bleeding after sex, if you're bleeding after intercourse, and that's for women who are sexually active, you
Mm-hmm.
should feel confident to say that, no, I know I bleed heavily, but I am getting this after intercourse. I would really want somebody to look into this for me.
Okay, fine.
Very
Mm-hmm. Mm-hmm.
very heavy bleeding where you are soaking through your bed sheets, you're sitting on a towel, you're changing a tampon every hour. That is not normal. That is not normal. Now, the other thing to look out for is abdominal swelling. You feel like your tummy is swelling up really quickly, especially certain times of the month, and you're even struggling to breathe. Those are red flags. When you begin to feel dizzy or you're fainting, those are symptoms, or extreme fatigue. Those are symptoms of anemia. So, when you begin to see these red flags, you should go to and make sure you speak to your doctor. The other thing is you feel you haven't had a period for up to a year, and then you start bleeding again. If you haven't had a period for up to a year, especially in your 50s, and you feel like, oh, I've gone through menopause, and you start bleeding again, that
Mm-hmm.
is another red flag. You should make sure you go and speak to your doctor. When you go to see them, you ask questions. You say,
Mm-hmm.
and you tell your story, tell everything,
Yeah.
build a picture for them, help them
Mm.
understand how it's affecting
Right.
you, how
Impacting
it's
your life. That's right.
affecting your work, how it's affecting your family life. And it's just not about the symptoms, it's not just about reproduction or
Yes.
fertility. The
Mm-hmm.
impact is having on your economic power
Yeah.
as well. You can't go
Yes.
to work, you're
Mm-hmm.
taking time off sick, and you're not earning enough. You have to be able
Yeah,
to tell
yeah.
them.
Mm.
Then the other question you need to ask is about the diagnosis. You have to ask the doctor, what do you think this is? Do you think it's perimenopause or fibroid? So it's really important to be aware before you
Mm-hmm.
go so that you can ask. Then ask them, do I need an ultrasound scan?
Mm-hmm.
Do you think I'm anemic?
Mm.
Okay, they tell you, okay, what are my treatment options? These are things people ask me, and people don't feel shy asking me, especially
Mm-hmm. Mm-hmm.
women of other races. Now, what kind of things should I look out for to make me come back to you urgently? What should I look out for in my body to make me come back to you so that you can help me?
Mm-hmm.
If possible, write down your questions before you go, or put your
Absolutely.
symptoms in your diary, or
Mm-hmm.
especially the pattern of your bleeding. Write it down so that you don't get lost for word, or you feel like, oh, I'm really struggling to know what to say. Write it down. Go with somebody who might be able to talk on your behalf if you feel like you're
Yes.
getting
Yes.
stuck
Yes.
as
Yeah.
well.
You're,
So
you're hitting
that's what.
all, yeah, you're hitting all my points. Thank you so much, Dr. Jai. Honestly, I am a big advocate for journaling. Write these things down. Have a journal. Make sure you're writing these things down because sometimes when we get in front of, the consultant or the clinician, we forget half of these things or most of these things. So if you have your journal, I go with my journal. Um, AI
Yeah,
is,
I at some point I had so many symptoms. I had to write it down. As in,
yeah,
like, just so many things were like,
it's key. It's key.
so many things.
It's key to really to journal to write it down. I advocate for that a lot, and also being able to support women. So this part of what we do in FHF network will also go with women to their appointments because sometimes when you're gaslighted, or you've had a clinician or a healthcare provider who's just not being empathetic enough, going with someone. I always advocate, reach out to us, find someone you can go to your appointment with, because that way you have support, and then that way you're also able to ask all the right questions, because either someone who is knowledgeable is there with you, or someone who can even prompt you to, with regard to some of the symptoms and all of that. So thank you so much for that. Lola, I was going to ask you, so how did you, on your journey, how did you maneuver? Did you have a community, a support? Did you have a support network? How has that worked for you?
So,
At is a
luckily,
community.
luckily and unluckily for me, I have a sister who has sickle cell. So, and they fight. They are always fighting for in the UK for for treatment and all of that. So she has taught me. She will tell them everything. No, tell them the worst day symptom. Don't tell them that it's getting no. Just tell them everything. So that way, if I cry, if you have to cry, you get there, just start crying. So yeah, so I was able to go, literally I'll do what she says, and they will answer you. The doctor does not want you to be crying in his office, or I remember when I went to when I went to the GP once, she took my blood pressure twice. She was like, okay, I'm sending you to A&E like right now, because I was just there doing as if I was about to faint.
Why
Then
you're
she was
doing
like,
drama for her?
looks like as in drama. She said, I'm sending you to A&E now. Now that was how I was able to get a neurologist appointment, like fast tracked,
Hmm.
So yeah. And then I'm new to the community, so I can't really say. I mean, yes, I go through the messages and the posts, and that's been helpful. I've even just recently asked someone to join, because she's also just been diagnosed with fibroid. She's really worried, because she's not had children and all of that.
Mm.
So I think the community definitely is helpful, especially around don't do this, what things that you find out around the food and all of that. What to do if you've got a done a hysterectomy, what to do. Don't take that as the first choice. Get a second opinion and all of
Oh
that. So
yeah.
I think that's been
Mm,
um,
mm,
very, very, very helpful.
mm.
But I think for me is, I think my advice to anybody is just fight for your rights.
Yes, push back, push back. Don't let anyone minimize your pain. Amazing, amazing. Thank you so much for that. And it's really, and lifestyle, food is key. Food is key. I mean, from a personal experience, from drinking the wrong milk, I know that food affects, especially fibroids, even perimenopause. I mean, there are things that you eat and that can make your life a bit better, not overly. I mean, maybe Dr. Diet should speak into that. And but what practical lifestyle change can do to help with perimenopause? Is there any tips that you can give, Dr. Jaye, regarding lifestyle changes?
Definitely. So lifestyle changes definitely start with, the six pillars of lifestyle. Um, First of all, I think I like talking about diets in fibroids a lot, partly because um, the way your body kind of metabolizes estrogen is slightly different, and the fact that you may have long-standing anemia where your blood cells are not carrying enough oxygen, and we know your red cells would need iron, and we
Mhm.
know you can get a lot of iron from your diet. So there are a number of different things. So first of all, if we look at things like eating a lot of fiber, there is something, I'm sure we've all heard about gut bacteria, the good
Mhm.
gut bacteria, and
Mhm.
how they have beneficial effects on reducing inflammation. They have beneficial effects on helping our immune system. So eating a lot of fiber is really helpful, because the gut bacteria help the body to clear excess estrogen that might be in the body that will be feeding the fibroid. So it's really important to eat a lot of legumes, grains, quinoa, you know, things like that that would help your body, that stays inside your stomach for longer, you feel full for longer as well, and they feed this gut
Yeah.
bacteria.
Mhm.
Vitamin D, we've talked about earlier on. Having a vitamin D deficiency can be linked to fibroid growth. So is either you're using definitely using a supplement to just kind of help to boost your vitamin D level in the winter months is really, really important. The third thing I would say is limiting foods that trigger and not many people will be aware of this, and that's where, we talked about the symptoms of perimenopause and fibroids kind of overlapping, but also the treatments of both can overlap, where we talked earlier on about,
Right.
people using phytoestrogens. So you really need to be careful with all these phytoestrogens that people talk about. If you're not too sure, ask your medical professional,
Mhm.
especially a medical professional that is good with women's health. But the idea really is to reduce intake of refined carbohydrates,
Mhm.
all these pizzas and meat
Pastors and
pies
varieties.
and all sorts of things like that, refined
All the things that we
carbohydrates.
like.
Yes, you do really need to cut it down as much as possible. Sugary drinks, they feed. It's almost like they are feeding the things that shouldn't be fed, things that should be starved in the body. But sugary drinks, refined carbohydrates, meat, especially processed meat, sausages, bacon, all those food of rich diets. Well, what some people think is a rich man's diet, or in actual fact is not, because you find that most people want to eat really what we call a plant-based diet. Obviously, things like alcohol, all of those can increase the inflammation in the body. So
Mm.
that's just one of the aspects of lifestyle, looking at your diet and how you can adjust. Obviously, managing stress is really important.
Yeah, yeah.
Stress from a lot of things, from your own personal stress, from career stress, even medical stress, from just seeing different doctors who are not really believing you, can
Yeah.
make you can make you stressed. So
Hmm.
learning and being proactive about finding some ways of reducing stress, whether through meditation or walks, breathing exercises, actually, or journaling, like we talked about, is really important. I'm not saying this is the only treatment. These are all things that are helpful in
Hmm.
addition to all the other things that you'll be doing. Exercise, I've talked about. This is not just to lose weight, but it also helps to balance out your sugar levels, especially your muscles and your joints. We talked about muscle joint pains. And when you do, especially even if it's just cardio, walking, brisk walking, or running or cycling, your muscles are like sponge. They mop up all the excess glucose or sugar in your bloodstream, which can cause what we call insulin resistance. And insulin resistance and all of that, they all feed into each other with high estrogen and all sorts of things that can cause the fibroids to go worse. So just gentle exercises, swimming, connecting in a community is really important for your
It
well-being,
is.
because then you don't feel like you are alone. And just that
Yeah.
feeling of being together with other people,
Yes.
it's really important.
Mm.
What else? Avoiding risky substances, sleeping well. All of these are all the lifestyle adjustments. And sometimes you might need someone to hold your hand or to keep you accountable to be able to do
Absolutely.
those things well.
Yeah. Yes. Thank you so much, Dr. Jai, because honestly, community is everything. I say I'm an advocate for it only because is a leverage, because you don't have to go through something that someone else has gone through. So in the
Gone through.
community, you are learning what you can do differently, how you can even address your own situation. I mean, every woman is different, but be able to go to your clinician or to your um consultant with the right questions to ask, because you've been in a community, and also hand holding is really key, because those are the things that I didn't find when I was going through. I thought, these are the things that, as little as someone's had a surgery and sending like a comforting pillow makes a is a little thing, it makes a big difference, because even knowing what position you can lie down after having hysterectomy is key. after having surgery, how you can lie, the right pillow, just little things that goes a long way. And for me, honestly, community, I'm big on community. Community is everything. We need each other. We need, to hold each other accountable, but also leverage on each other's experiences. And also, it's also in the community you can find, because I also tell women, you need to explore all your treatment options. Don't let anyone push down one treatment away to you and say, oh, you only need hysterectomy or you have this one. Explore all of the options. Check, ask the questions. What are my options? Is that the best option? Is there something else I can do differently? Ask all of these questions. And it's so community. I'm big on community. Thank you so much, Dr. Jai, and thank you, Lola, as well. Our time is really fast spent, but before we go, I wanted to ask, to every woman who's joined today, what would you like to leave with them, Lola? What would one thing
Mm,
you want to say to women who have joined
two
today
things.
for
Maybe
them
I'm
to
only joking. I
remember?
have two things.
Okay, go on, do really two
The
things.
first, the first thing is you're not alone. I think that's really important to know that you're not
Absolutely.
alone. There's a way that when you're going through stuff, it just feels like you're the only person in the whole world. Even telling people that you're in pain all this. Sometimes I just keep quiet because they're like, "Hey, you're in pain again." I'm like, oh, or sometimes they're looking at you and like, "Hey, are you in pain?" I'm like, "Yeah, I'm in pain just because I'm not saying it." So you just want to keep quiet and you can do something to your mental. You feel very
Absolutely.
all right 1 minute, next minute you're in pain. It's like, oh, this pain again. So you're not alone. I think that's the first. Second thing is see, I forgot to. The second thing is fights. you know, in that UK where we're in NHS, it's somewhere like Nigeria now. You just go to your doctor and you can guess whatever you want. But in the UK where everything has to follow one process and all of that, fights as in fights for
Yes.
what you
Yeah.
need. Don't take no for an answer. In fact, at one point I was going to patient list, so I will write the consultant. If you see the message, all the plenty email I write, I wrote it. I got the name of the chief executive of the NHS trust. I wrote to
Yeah.
her as in like that, as in they need to do something. I cannot just be in pain. So
Absolutely.
they will listen eventually because they don't want you to. In fact, at one point he said, "Do you want to go to another consult?" I said, "That's not the point. I just want you to listen to me. That's what I want."
Exactly. And
So I think just fights.
yeah, thank you so much. And that's the whole idea, is really, really speaking up for yourself and pushing back and advocating for yourself, insisting, because no one should minimize anyone's pain. I mean, you is the woman who knows what exactly she's going through. And if I turn up to you and you're minimizing my pain, I'm going to push back. I'm going to insist, ask to speak, and see everyone who's possible necessary to be able to get through, to get the things that I need to for my wellness and my well-being. And you're absolutely right. Thank you so much for that. Thank you so much. Our time is really fast spent. Dr. Jaya, I'm going to come to you. One action you think um everyone who's listening or who will listen to this should take away from this conversation, what should that be? What is your
Well, I
final takeaway to women?
I always believe that every woman deserves to be believed, to be listened to, and to be offered real choices. And really, you should not normalize suffering. I think that's really important. If you for any reason feel like you're suffering, don't ever feel like, well, you deserve it because you have done something bad in the past or you've made some decisions in the past. Don't ever normalize it. There is support available, and there
Mm.
are doctors out there who would really love to look after you. You just need to find the right one.
Yeah, yes, absolutely. I like that. You just need to find the right one, because there are doctors out there who would love to look after you. Not all of them are bad. Thank you so much. I mean, 1 hour is already gone. And this conversation is not even over, because there are questions even more questions that I have, and I know that we should come back and do like a part two of this, because I have question around HRT. I want to dig deep into
Yeah, yeah,
HRT treatment, honestly, Dr. Jai. So we're
yeah.
going to bring you back and we're going to dig deep into HRT and have that conversation. But it's been amazing. And I mean, 1 hour went so quickly, because we're talking about these things and the important things. And for me, is all that I'm going to bring to say to women is know your body, track your symptoms. Journaling is amazing. I mean, for me, apart from the fact that of the brain fog, it also makes me remember,
As
remember,
in,
you
I
know,
I have to set alarm. I set alarm, originally alarm, so I will remember. Oh, is that
I have,
bad?
yes, yes, because I have notes everywhere in my phone, all around me. I have notebooks, notepad, different notepad for different things. So please track your symptoms, write journal, ask questions, and seek support early. Seek support early. We have heard Dr. Jai say there are doctors there who are happy to look after you, who want to look after you. So don't stop until you have found the right one. Thank you, everyone who's joined tonight. Share this conversation with a friend, with a sister, a colleague, someone who will benefit from it. And I hope that this has been useful until we come again and we bring you Dr. Jaye and some of the, because I want to talk about HRT and I want to talk more about perimenopause because this thing is happening live and direct. Yesterday, I was talking to someone about it, and is mental health in perimenopause or menopause, whatever stage you are in, is a real thing. So yes, we're going to be back and talking about that. But thank you so much, ladies. I've enjoyed speaking to you and having this conversation around fibroids and perimenopause. Thank you very much. Thank you, Lola. Thank you, Dr. Jai. Have a
Thank you. It's
beautiful.
been a
Thank
delight to
you.
talk to. It's been very enjoyable. Thank you for inviting me.
Thank you. You're
Thank
going to be back.
you.
You're going to be back. Thank you, ladies. I'm grateful. Thank you.
All
It was
right.
talking to you. Have a good night and God bless.
Bye.
All right.
Good
You
night,
too. Take
everyone.
care.
Thank you, everyone
Bye.
who's
Bye.
joined. Good
Good
night.
night.
Bye.
Bye.
Bye.